17 deaths, more than 400 sickened, including a man in the state of Washington. The newly diagnosed coronavirus, first reported in December in Wuhan, China, is fueling international concern. As we told you a few minutes ago, Chinese officials are shutting down travel in and out of Wuhan. Now, that's a city of 11 million people. The hope is they'll stem the spread. But is it too late? What is a coronavirus? How is this similar to other outbreaks like SARS? Bottom line, what do we need to know about it? Dr. Arthur Grant is an infectious disease specialist with Troy Infectious Disease, affiliated with St. Peter's Health Partners. Good to have you here with us.
Thanks, Benita.
So we've got a picture of a coronavirus up behind you. What is it, in essence? And you know, that's what causes a cold, right, is a coronavirus?
Coronaviruses are among the most common viruses that cause human disease, and they cause disease in many species of animals as well. Coronaviruses do cause the common cold, but they have been associated with outbreaks in the past. You mentioned SARS. There was also about 8 years ago the MERS-CoV coronavirus, which was implicated in outbreaks in multiple countries in the Middle East.
What makes this so worrisome? I
think what we worry about now is that we just don't know that much about this new virus. We presume that it came from spread from an animal source. We're still not sure about the transmission from person to person, whether it can be transmitted aerosolized or through other means. We also have not seen enough cases to really understand the virulence and how deadly a virus it can potentially be.
So more than 400 sickened, 17 dead. This is just what is being reported, and those numbers are changing. They may already have been increased by the time we finish our interview.
This is what we've heard so far, and then we've had a few cases outside of the Wuhan area, both in China and outside of China.
If somebody has travel, international travel planned, what should they be doing?
If they're traveling anywhere other than Wuhan, they should not do anything differently. Take standard precautions because there are many viruses circulating at this time. The most worrisome, of course, is influenza, which has been ramping up activity over the last few weeks.
And this coronavirus, does it present like the flu?
It's tough to say. They both cause febrile illnesses with respiratory distress, difficulty breathing, and occasionally multi-organ failure. Severe cases of influenza can look very similar to what cases of this might look like.
So in the next couple of days, next few weeks, if somebody presents, if somebody develops, you know, they had that hit by a train feeling, you know, sick immediately, a headache, fever, difficulty breathing, you know, a lot of folks are going to think, oh my goodness, I've got this new bug.
If you have not been to Wuhan, China, or been in close contact with anybody else who's been to Wuhan, China, it's very unlikely that you would have this virus. As of right now, there's been a total of 1 case in the United States reported in Washington State.
And he had been in China.
And he had been in the city of Wuhan, China.
So bottom line, right now, we need to be taking regular precautions, washing our hands?
Taking regular precautions, washing our hands. If you're sick with a respiratory illness, stay home from work. Try to avoid people who are otherwise have other medical problems, compromised immune systems. General precautions, and of course, if traveling to an area, if you're traveling to Wuhan, you should take special precautions because of the outbreak.
And right now, they probably won't let you in. Dr. Arthur Grant, infectious disease specialist, thanks so very much.
Thank you, Benita.